Hi, Tizzy,
Hi, Will.
and hello to everybody else listening. So, this is the first of a series of really incredible conversations about partnership and collaboration for drowning prevention, focused specifically on statewide coalitions for water safety. By way of introduction, my name is William Kuhn. I am a drowning prevention researcher and practitioner from California, and I'm part of a larger group of stakeholders in the state who've been working to launch a statewide water safety coalition. So in California, we are really lucky to be starting out with several active and really amazing local coalitions. We also have a strong track record for statewide collaboration, and I think most importantly, an amazing group of passionate drowning prevention advocates. So, as part of this effort to establish a more formal mechanism for statewide partnership, we thought it was prudent to look beyond our own state and intentionally seek to gather some lessons learned from other states who've been down this path before. So, to that end, to provide a bit of guidance in this learning process and some wisdom and insight, I invited one of my mentors and dear friends, Tizzy Bennett, to help us figure out how we could do this work well and share it in a meaningful way. So, Tizzy, first, thank you for being so incredible throughout this whole project. Would you please provide those listening with a bit of context on who you are and what your connection is to drowning prevention?
You bet. So, my name's Tizzy Bennett, and I started working in drowning prevention in the early 1990s in my role at Seattle Children's Hospital. And over 30 years, have done a lot of different programs and initiatives and campaigns, including being heavily involved in the start and maintenance of the Washington State Drowning Prevention Network. I also have a deep background in public health and have really brought that to this work in drowning prevention. And now I co chair the Life Jacket PFD and other flotation working group for the development of the first United States National Water Safety Action Plan.
Thanks, Tizzy. So, when we first started talking about what it would look like to try and characterize some of these lessons and advice on state level water safety groups for the California effort, you and I began to see that, the lessons learned were probably applicable beyond, this specific effort for California.
That's exactly right. So, in our interviews with these state leaders, you might hear us or them refer to California or the efforts underway in California. But I think the advice and lessons they describe are really for anyone who's looking to do some learning around collaboration and partnership for drowning prevention, whether that's at a state, a local, or a national level. I think this project and the lessons learned here are especially relevant for those working in drowning prevention in the United States, as next year, the first National Water Safety Action Plan will be released. These conversations may be a great place for those looking to start some sort of collaborative group to tackle the national plan's recommendations or provide some motivation, new thinking, new ideas for those groups that are already established. If anything, I'm hopeful and we're hopeful these interviews spark conversations among and between individuals, organizations, and coalitions who are dedicated to preventing drowning and keeping people safe in and near the water.
Excellent. So before we get into our first interview, a couple logistical items. Tizzy and I sent each person that we interviewed a short list of questions so they could get an idea of what we were going to talk about. So you may hear people in these interviews refer to the written questions in our conversation. We held all these interviews on Zoom so we could see each other, but we only edited the audio for release here. Lastly, Tizzy and I are passionate water safety people, but not professional podcasters. So thank you in advance for your understanding as we've done our best to make this an informative and enjoyable listening experience for you. So with that, Tizzy, can you transition us to our first interview?
Thanks, Will. And it is such a great privilege for me to introduce Tony Gomez. He is my friend. He is my mentor. He's been my longtime colleague. And Tony has been involved with drowning prevention with Dr. Linda Kuhn and me and many others in our state for longer than I have been
Mhm.
involved, and that's a really long time. And he brings such a wealth of experience and perspective and wisdom to this idea around drowning prevention network. And earlier on was a coalition in Seattle and King County. So this is such a great way for us to launch.
As we look forward to this interview, is there any kind of background information that the listener should know about?
Just a couple of quick things. When Tony says children's, that refers to Seattle Children's Hospital, where I used to work. And when he says Harborview, typically he's referencing the Harborview Injury Prevention and Research Center. Harborview is also a medical center, so he may also be speaking to it as a healthcare organization as well as an injury prevention center.
Just one more thing. You will hear Tony reference something called the Prevention Institute that we strongly recommend you do a quick Google. The Prevention Institute has some really incredible resources on developing effective coalitions, collaboration and assessment tools, and some actually really helpful information on this idea of turf and tension between different stakeholders. So it may be helpful for you to look up the Prevention Institute. With that, this is our conversation with Tony Gomez from Washington State.
Tony, I would love if you could introduce yourself and give us a little bit of background on who you are and what you do and how you got into water safety.
Yes, I'm Tony Gomez, and I manage violence and injury prevention at Public Health, Seattle and Dr. Martin Luther King Jr. County. And I've always had an interest in drowning prevention going back to when I was a high school lifeguard and hearing of people drowning in lifeguarded pools and kind of thinking, how could that happen? And then as well, from doing rescues myself, in some open water as well as pool situations. So I think, like many involved in this field, it's both personal and professional.
So I want to jump in and talk about the Washington State Drowning Prevention Network. And I'd like if you could paint a little bit of a picture for us of how that group started and maybe what some of the early days looked like.
Yeah. So in terms of the start of our water safety work, it actually originated with a small CDC grant. The injury field does so much with small grants. So Harborview Injury Center was serving as a steering committee member and leader, and they identified these, I think it was $8,000 or $9,000 grants in order to start drowning prevention coalitions. So we applied for a local one for King County. State of Florida decided to go for the whole state of Florida with theirs. And in convening members, we decided to do what good public health folks do, which is look at data, what are the numbers, where are they occurring, see what our role might be, and established our county coalition. And then we were just so fortunate to have Children's as a partner from the outset with this collaboration between the Academic Center of the University of Washington, Harborview, Seattle Children's, and Dr. Kuhn, and then Tizzy joining us because her energy and abilities really brought us up to a new level. And so when we became a statewide network, that was largely as a result of Tizzy, Kathy Williams at the Department of Health, and a CDC grant. Again, probably not a huge grant, but enough that it brought kind of credibility to the work, and it brought some staffing, and it was allowed us to continue to grow the number of partners to have the most effect per amount of time we were putting in, given we were still largely a volunteer organization of sorts in that people were either volunteering time or carving out of time out of their kind of regular work for this effort.
And Tony, I also remember that in the early days of the King County and Seattle coalition, people started coming from lots of other counties because they were interested in drowning prevention. So that was part of that evolution to a statewide network as well, is that we were seeing in a one county coalition, there would be 8 counties coming to that.
Yeah, that's a good reminder that part of it was um, the injury and violence field at the local health department level, and even at the state, was still in development phases. There was some injury prevention, especially drowning prevention, occurring in environmental health divisions throughout the county because they were responsible for assuring health and safety at the regulated pools, hotel, motels, clubs, apartments, that type of thing. And then water parks, we went from having one water park in King County to like I think 8 were being proposed at one time. And this explosion of water parks around the country and even in our state brought a lot of interest from that environmental health side, along with maternal child health interests. And so that was part of it was bringing in statewide folks, other county folks, and and then going through some trainings together. One of the important tools we came to learn about was the spectrum of prevention out of the Prevention Institute. And in looking at that framework with policy development at its top level, working with community, working through organizations, down to individual level improvements like teaching swim lessons one at a time or in a group setting or distributing life jackets. We just decided we needed to work through all of those levels of the spectrum to have a chance to be effective. And in terms of a galvanizing event too, as we were trying to figure out how to establish ourselves, one of our members, we found out that Arizona, where they were losing a kid a day to mostly backyard pool drownings, had done an event called April Pools Day. And they had trained, I think, 40,000 some people in Sun Devil Stadium on CPR. Well, we talked about whether that was a model for us and learned that, we're pretty much a great CPR Medic 1 in town. So probably wasn't our need here, but everybody loved the April Pools Day name. And so we turned it into our own event with allowing pools to open up their doors to the public, have a free swim, learn some water safety, and then bringing in elected officials and other celebrities and our members to get some attention early season with water safety. So it was fun to have those early galvanizing events, and it really was a strong co-leadership between health folks, the hospitals, Seattle Children's, the parks departments at state and local levels, and then industry was also very interested in getting on board.
I love how you brought up April Fool's Day, Tony, because one of the things that's so great about it is many people in the water safety arena are practitioners at heart. And April Fool's Day was something we could all get behind. And it took a more theoretical data and brought it down to what's something I can do in my community today, next week, next year. What's something we can all do together and then have a community-based, approach to it. So April Fool's Day is a really great example of an actual activity we got involved with, but also just help people get going. I'm going to move us on to for you to talk a little bit about how the Drowning Prevention Network is organized.
So our current statewide network has leadership from Washington State's parks boating folks. So that brings a lot of the open water and boating. We also have the Washington Parks and Recreation Association, which includes the lifeguards, beach managers, pool managers, a lot of that field. Includes health with Seattle Children's really kind of serving as our kind of lead agency, if you will, in terms of organizing and convening. We've gone from, originally back in the day from monthly meetings to twice a year and right now virtual meetings. It also includes our Safe Kids Coalitions, which are some fabulous partners, and the State Department of Health, which has been good. And so we've just kind of feel like we have everything covered from big water boating, to pools, spas, even the backyard pools, where we've had some accomplishment over the years as well in reducing drownings.
So, Tony, you've got a really diverse group of stakeholders in that group. And from the history, what you just described of it, it started as being very health focused, right? Seattle Children's was involved, Harborview was involved, King County Public Health was involved. And now it seems like lots of the more recreation folks are involved, which is great. I want to ask you a little bit about leadership and quickly governance structure, because a lot of folks who are looking at establishing coalitions, they're looking at, do we have a board? Do we have an executive director? Do we have a lead agency? There's all these different models. So can you describe just quickly who leads the coalition and how does the actual administration of the group happen?
Yeah, currently it really is consensus and consensus building. We plan our meetings, and we're in the middle of one now. We had a morning today and then a morning tomorrow that will finish in order to give a well-rounded set of programs and activities underway. So we did look at, because again, the Prevention Institute had a nice paper out on, if you're going to undertake a prevention effort, do you form a task force? And what's kind of the definition of a task force? And it's kind of a time limited sort of thing. Do you form a network? Are you a coalition? What exactly are we? And I think our network structure is nice in that it is the shared leadership. Everybody's willing to do some level of work. And we're going to start also having shared facilitation of our meetings. Done it for a lot of years, and tomorrow our Seattle Parks Aquatics person is going to lead us, and we're going to continue to build on that. And I think, it's kind of like almost interchangeable in a sense between a coalition and a network, but even a network's a little less governance structured, and that a coalition, you kind of have a coalition chair. There are lots of places where they do have boards and kind of set out established bylaws and guidelines. Safe Kids and some of those models have those. And I think for where we're at with the funding we have, that it's probably the best structure that exists for us. It may be that for another organization, depending on funding or hierarchy, there may need to be a more formal structure. But these are all things to explore with a steering committee as one would start to develop a new program.
And Tony, would you agree, having now been doing this for 30 some odd years, the coalition, that back to the way it first got started with a little bit of money for admin support, there has to be an organization that's willing to put in some resource for admin support. And right now that's Children's Hospital that's doing that. When we have not had any capacity or ability to have admin support, it's felt like it's been harder to just pull off the logistics of bringing people together and keeping momentum going.
Yeah, absolutely. Without Seattle Children's, I'm not sure we would, in your work, have a network at this point. We probably would have something, but it wasn't what we're able to achieve today. So it really is important that leadership of the organization at the highest level knows about this and supports this. And it's part of what I'm kind of revisiting right now with our need to develop a better King County area plan, given we've seen some huge increases in drowning as a result of both increased warming, so more exposure to the water, and probably less supervision with the lifeguard shortages. And it reminded me we need to get our highest level of elected leadership um, more aware of the importance of aquatics, water safety, and to build those bridges with the climate change leaders that are embarking upon their work, chronic disease prevention for a healthier community, and then even importantly, the disaster preparedness folks, because as we've seen play out here, there's a whole lot of communities that could have benefit or could benefit from having life jackets in every home during a flooding event, or having life jackets readily available in tsunami, earthquake prone areas. And that, having those resources of those nature available and getting more general usage in non-emergency events, probably at a population level, because we in public health, we in the leadership field need to think about that population level work. So having those resources and information and those partnerships, I think, helps make for a safer situation for our population as a whole.
And as you say that, one of the questions that we have on the list today is, how do you keep a coalition going over a long period of time? And one of the ways you do that is by evolving, recreating, looking at how things are changing. And those are great examples around disaster response, climate change. It's really great. I'm going to move us to the next question, Tony. And of course, this is one of my very favorite questions, always is. Talk a little bit about what you think have been some successes as well as some challenges of the group.
I think at that high level policy change, Seattle Children's Tizzy Bennett leading the passage of the life jacket law for children that continues to be discussed, came up on today's call. Oregon would like to advance something along those lines because they were referencing some 50s laws. And so I think that was a great accomplishment of the network with the strong leadership out of Seattle Children's. So that's on kind of the one end of the spectrum. On the other end, we were able to get state law changed for backyard pools, that all new pools have to have good four-sided fencing and education around that. So that involved getting the Building Code Council, legislature, governor to adopt these changes based on best practices. So that was extremely helpful. And I think one of the other accomplishment is the championing of child fatality reviews, our most precious resource, our most vulnerable children, looking at those cases in order to look at the factors that led to and would prevent those deaths. And if, the entire world had a child fatality review process that led to policy and other prevention efforts, we could probably, like we did in King County for 3 years, we had no child drown in our, population here with all the lakes and rivers for a 3-year period. So it shows that you can really accomplish tremendous things with those prevention efforts.
Tony, real quick, for people who might not know what a child death review team is, in 10 or 15 seconds, could you describe what that looks like?
Yeah, it's an expert committee and can include community members. It comes together to review all the factors that led to a child death, typically under confidential legislative proceedings, so that it's not available and open to media. It's not a public meeting because of the kind of conversations that would happen. And then it allows those recommendations to be used for future prevention efforts, from policy to that individual level change, kind of within that spectrum of prevention framework.
Awesome.
And kudos to you, Tony, for what you've done to actually bridge that from seeking to understand what happened in a child drowning death to how you take a prevention recommendation that might be made in that group and actually move it forward versus all that happened is it was said in a room and nothing further. So I think that that's a great connection and why bringing in public health along with drowning prevention and water safety organizations really helps to do that bridging. How about challenges?
Well, it's both an accomplishment and an ongoing challenge. Is our open water guidelines work? Um, Seattle Children's Department of Health getting the CDC grant to develop the best practices on open water. You would, we want lifeguards at our swim beaches. We also want clean water there. So a clarity and an operational plan and a review system. And, it's an excellent model and it's voluntary at this point. We've now done the literature review, done the research, that published a paper that shows that states that have stronger open water rules and regulations have less drowning in these types of settings. So our challenge is even to get our state to adopt and move in that direction. It was supposed to happen some 35 plus years ago when I started, and it's kind of the one remaining unmet need out of our environmental health group. And I think the challenge of COVID is a valid reason for putting everything on hold. But as soon as we get the chance, we got to help try to push and scoot that along so that we're not at the end of the line again.
Tony, can I ask, maybe it might not be a challenge in your group, but in many groups that have lots of different people involved from different sectors, getting everybody on the same page and getting everybody to collaborate can be difficult. Something that I loved about the Washington Drowning Prevention Network meetings was sitting in a room with folks from public health and folks from the sheriff and folks from fire and folks from Parks and Rec and the people who ran the water parks and the environmental health guy who's talking about microbes in the pool. Like, it was just such a diverse group of people. Over the history of the coalition, has it ever been a challenge to move those folks in the same direction? And what kind of advice or recommendations would you have for groups who are setting out to embark on this process with lots of different people involved? How do we get all the people to play in the same sandbox over the long term?
Yeah, that's a really good question. And I think it has been challenging because there's some of our attendees are there to hear the information, to present what they're working on, get some ideas, but they really have no interest in advancing policy. And so as we kind of thinking about future work, I think there is a role for subcommittees. And it came up on today's call, for example, of we probably need some breakout sections on, because the topics are so diverse, and see if we can get some folks to work on various of the topics in a subcommittee setting. Given, hopefully we'll get improved resource at some point, similar to other public health areas, to have both leadership and membership funded at some level. But absent that, I think we're going to have some topic specific subcommittees that are going to have to tackle some of these things, and then folks can self-select what they have interest in. And it may be that we have the broader meeting with lots of attendees and lots of interest and lots of interesting things shared, and then when it comes to specific work, we end up with 4 to 6 folks that are part of that subcommittee that is going to put the hours in, with perhaps a broader group of community and other stakeholders that have interest to try to advance whatever that issue is.
That's super helpful. I think that, that self-selecting committee is really powerful because it gets experts in there, and then figuring out a clever way to make sure that there's cross-pollination between those groups is key, right? I want to ask you both one more question on this topic, and it has to do with geography. So from your early days as a Seattle King County based coalition expanded to a statewide coalition, how did you manage to ensure that folks in Eastern Washington, or I mean, the southern part of the state, were included and felt like they were valuable contributors to the coalition? Because I think in lots of regions, and like my home in California, our water safety world is very Southern California focused, right? And we want to include the whole state. What recommendations would you have for that regional inclusion piece, either Tizzy or Tony?
You go first, Tizzy.
Well, when we first started, we would meticulously have one meeting on the west side of the Cascades and the other meeting on the east side of the Cascades. So we were very attentive to that and wanted to be sure we were not only driving out of Seattle and King County. As time has gone on, having a place where you have all the technology, it's really about removing barriers to participation. And one of the ways to remove barriers to participation is to make it accessible. And now I think we have so much more available to us over the last year and a half, actually, to have Zoom meetings, to have both in person and Zoom, where you can bring people together in that way. But we have tried to have conference call options and video, teleconference options and Zoom options and geographic options. But that I think those things have helped. Tony, what about you?
Yeah, that was good because I had forgotten we had that very conscious conversation about going east and west and taking the effort. And sometimes we go east and we just get a few extra folks, but we made the best effort we could and still be a great meeting. But I think too, something Tizzy and Children's did would invite speakers from those parts of the states too to give their programs, so that they're invested in the work. And then as they decided to try to do something in their local region, it was often encouraged, like, hey, is this something that could go statewide too? And so then the folks out of those other regions would work on that to make it available to others. And then, a lot of it also includes, being able to encourage and have kind of frameworks for how to have consistent messaging across the state. So when they do media in Spokane or another part of the state, we're saying pretty much the same thing, and instead of get away from this non-specific, be safe out there messaging to, like, what are the very concrete actions that our network agrees to in line with Coast Guard, AAP, American Academy of Peds, or others, or we've established, so that we have that consistent messaging, and so that then as they do media in their own region, they have the tools that make them feel comfortable with it. And then the last piece is that, Tizzy also wanted everybody to do the round the table updates, 3 to 5 minutes. And so that's where we would hear from what's going on from each person around the state. And then they're invested in what they're going to be thinking about and presenting. And today's conversation, for example, included, like, it stayed over 100 day after day in Eastern Washington this year. And the person out of Ben Franklin was saying, and it was not only just 100, it was like 115 and 117. And it was really a tough summer. And the national media kept showing the Space Needle and continues to do so when they talk about climate change and heating. It's like, we had like 3 hot days here, okay? Why do they keep showing the Space Needle when Eastern Washington was just boiling for a month and a half?
Yeah.
So
I can imagine too that consistent messaging is really helpful too, even just within the different sectors, right? So the swim school is saying the same thing as the fire chief, which is saying the same thing as the Coast Guard, who's saying the same thing as, all the other people in the room, which is really valuable. So, we are kind of running out of time. And so, Tony, I want to ask one last question, which is broad. And that is, what would be your advice for folks who are starting this process, who are looking at forming a multi-sectoral coalition to advance water safety and drowning prevention in a community? What would be your advice for those folks who are just starting out on this journey?
Well, I think getting your local or state data would be a great start. And then I think that our field shares and works well together. And there's any number of folks that would be glad to help with some ideas and some discussions. I expect both of you would be very helpful and willing to do that. I'd be willing to do that. And then other drowning prevention experts around the country are always willing to share information. And so, have those conversations so that you can kind of envision what you want to do, where you want to go, um, as you use the data to inform your work. Look at the literature, um, think about best practices, think about best practices for coalition or network building, and then what are the sorts of rewards that attendees can have to sell it to their organizations for both visibility and actual prevention or effectiveness, to then continue to do the loop to just assuring an important public health issue gets addressed.